Hello, everyone. Let's go through some axial skeletal anatomy. So, hopefully, you have your packet with you, and you can either just look through my slides and fill out all of the starred locations of bones and bone structures that we should know, and or you can go through this video with me where I'll point them all out and I'll give you some ways that I think are useful to study this material. Okay, here are learning objectives. Basically, we're going to just run through all of the skeletal structures that we're supposed to know, and then I'll talk about some specific, interesting stuff that I'd also like us to know. Okay, you can maybe leave this first image blank and use that for studying. We're basically going to go through axial skeletal anatomy today, which is all of the bones of the skull and face, the vertebral column, and then the rib cage. And then we'll go over appendicular anatomy in a different image. But if you want to just leave this one blank at first, just use that one to study. Let's first start off by looking at the specific bones of the axial skeleton that we should know. Here are some bone features. I'm not really going to ask us to know each one of these in detail. Instead, we're going to learn where each one of these structures are on the body and just get to know their names. But here are the definitions in case you want to go back and look at some of these. Okay, let's start off with the head and look at the skull anatomy first and then the facial anatomy next. When we look through these PowerPoints, the bold structures are the ones that the bones that I would like us to know, and then I've got some other structures that we'll be covering as well. So let's jump into it. Here's all the stuff that we're going to learn about the skull, but let's look at some images here. Here should be the first image that you can start taking some stuff down here. First, when we look at the skull right here, let's separate out the main skull bones from these facial bones in the front. So when we look at this frontal view, we can see this big bone that makes up the upper part of our orbital or our eye socket and then our forehead. This is called the frontal bone. The frontal bone can be seen nice and easy from this view right here. Other major bones that we can see from this view include like our cheekbone, the zygomatic bone, the upper part of our jaw in this, I don't know, like a orangish color, like a light orange color, and this is our maxilla. And so I'll also try to point out where these are written. So here is the maxilla. Then we've got another zygomatic bone on the other side, and forming our bottom part of our jaw is our mandible. A couple other big bones that we can see from right here. There are better views of this, but we can see the parietal bone, which is on the side of the skull. And then we can see the temporal bone on either side. So there's two parietal bones. And then we can see this temporal bone on the other side here as well. The bones of the face and inside of our eye socket are the more challenging of the bones to check out. But let's try to work through these from this view and see what we can see. This tip bone, the tip of our nose, this bone right here is called the nasal bone. So we can see the nasal bone sort of at the tip of our nose. And then I like to work back all the way through the orbital or the eye socket, and you can get to see most of the bones of the facial bones there. We can see the nasal bone. The next one that we can see right here, this orange one, is that maxilla again. Moving back, we can see the lacrimal bone. It's the small bone. It's kind of right where our tear duct is. I'll point it out again. This is like a light green. We can then see this purple bone right here, which is the ethmoid bone. Ethmoid bone is this purple one right there. Then at the very back of the orbital, we can see the sphenoid bone. And then we can see that zygomatic bone forming the lateral side of the orbital. And so as we've been saying, that this whole opening right here for each one of our eyes, we can call that the orbit or the orbital. Sometimes we call it the eye socket. Let's call it the orbit. And then you can see this hole back here is right where the optic nerve, the back part of our eye, would send information to our brain. So this hole right there is the optic canal. You can see the optic canal there. Other structures from this view that we can see on this mandible right here, we can see this little hole right here, which is the mental foramen, one of the holes of the jaw or the mandible that I'd like us to know. And there's other views that we'll check out some other ones. Anything else? We can see this coronal suture, or the joint between the frontal bone and the parietal bone. And that joint right there, where the two bones are fused together, that's the coronal suture. The coronal suture right there. So there's a couple bones that we can see inside of the nasal cavity, and I'm going to point these out now, but there's other views that you can see them a lot better. The first one that you almost can't even see right here is the palatine bone. There's a tiny little hole right here, and you can see the palatine bone underneath the maxilla, but I'll show us better views of that, so don't worry about that one. Inside of this nasal cavity here, we can see the bottom part of this purple ethmoid bone right here. And so we can see the perpendicular plate of the ethmoid bone right there. And then this bone right here, it's like a little fin that sticks up into the ethmoid bone, and we can see the bottom part of this fin right down here, and that's called the vomer. And I'll show us another image of that in a second. The other one that you can see, and it's not labeled here, but you can see these inferior nasal conchas here, and there's another concha right there. So you can see those inside of the nasal cavity there. Okay, let's take a look at some other views and keep putting all of these structures together. Again, we have the frontal bone is on the forehead. We've got the coronal suture separating this frontal bone from this big parietal bone right here. On the back part of our skull, we can find a new skull bone, and this kind of finishes up these major skull bones here. We can see this, I don't know if it's like a pink color, this pink occipital bone right here. Here's the occipital bone on the very back part of our head. We'll look at an inferior view and see a better image of this as well. Around our ear, we've got the temporal bone. And again, the frontal, parietal, and there's two parietals. Temporal, and there's two temporals, and then there's one occipital back here. Those form the big bones that encase the brain. The other sutures that merge these other skull bones include this one right here, which is the squamous suture, and this squamous suture separates the parietal and the temporal bone. And then we've got this lambdoid suture right here that separates the occipital bone from these other two bones, the parietal and the temporal. You can't really see it from right here, but there's one more suture that I'm going to show us, and it comes down the center of the skull, and it separates the two parietal bones, and that's sagittal suture, and we'll check that one out in a second. Other structures here that we can see, or let's go through the bones first. So the other bones that we can see right here, in between the frontal, parietal, temporal, is this bone right here, which also forms the back part of the eye. And this is the sphenoid bone. That's the sphenoid bone. We've got this green bone right here, which is the zygomatic bone. We can see the maxilla and the mandible. And then now we can see some of these facial bones kind of nicely from this view. The tip of the nose, we have the nasal bone. Working back, we've got the maxillary bone, or the maxilla. We've got that lacrimal bone right where our tear duct would be, and then now we can see that ethmoid bone from a little bit of a different view there, the ethmoid bone. Other structures that we can see from this view. This is a great view of this structure right here, which is kind of like a little bridge that goes between our cheekbone, the zygomatic bone, and our temporal bone, the one around our ear. And this thing right here is called the zygomatic arch. The zygomatic arch can be right here. Other structures, we can see the hole where the nerve and our ear canal meet, and that hole right there is the external acoustic meatus, and a meatus is like a hole in the bone. It's like a really thin tube, kind of. And then we can also see this large rounded process, and you can actually feel, if you feel behind your ear, there's this rounded part of our bone that a big muscle attaches to, and when it pulls, it can rotate and pull your head. And that rounded process right there is the mastoid process. There's the mastoid process. All right, anything else from this view? I think we got them all. If you see any stars that we ever skip over in the video, just write them down and we'll cover them when we look at our models and stuff. Okay, keeping it moving here, this view is from an inferior view. So we've removed the mandible, the bottom part of our jaw, and then we're looking up through the skull from below. This is the anterior surface, the front of our face, and here's the back part, or the posterior surface. Okay. Some major bones that we can see that we've already talked about. This one right here, the bone-colored one, this is our occipital bone, the one on the back and bottom part. You can see the little edge of the parietal bone right here, and then we've got our two temporal bones on either side of our skull there. This yellow bone right there is still part of the sphenoid bone. Now we can see an inferior view of it. And what's really cool is we get to see some of the inside of our mouth and the top part of our mouth here. So this bone right here, this orange one, is the maxilla bone. But from this view, we can see where the inside part of our mouth is and the top part of the mouth. And this surface of the maxillary bone is called the palatine process of the maxillary bone. It's a specific structure that I would like us to know. It's the top part of your mouth. If you bite into a really hot piece of pizza, you're going to burn the palatine process of your maxilla, or at least like the epithelial tissue that's right there. If you slide back or more posterior on the roof of our mouth, you hit where the soft palate of your mouth is. If you push your tongue up in the back part of your mouth, you'll feel this soft area back here. And there's two bones that meet up back here, and these are the palatine bones. And I'd like us to know that there's two of them, but there's these palatine bones right there. And then here we can see the bottom part of that vomer bone, which was the fin-like bone that was sticking up between the inside of the ethmoid bone. We can see those zygomatic arches again on either side. And so we've got the zygomatic bone forming one part of the zygomatic arch, and then the temporal bone forming the other part of that zygomatic arch. And there's a big muscle that fits through this hole, and it grabs onto the lower jaw and gives us most of our bite strength. Okay, I think we've got the bones down. Now from this view, we can start to see some of the interesting structures that occur here. And for the majority of these, we're going to be talking about holes through the bone that nerves can run through, sometimes muscles run through them, and blood vessels can run through these things. So the first and biggest hole is this one right here. This hole right here is the foramen magnum. It's sometimes called the magnum foramen. So this foramen magnum, what would go through this hole right here? This is where our spinal cord and our brain can meet up. So we've got the spinal cord and brain moving through the foramen magnum. On either side of this foramen magnum, we can see these two rounded surfaces, one right here and this rounded surface right here. And when we look at the models, it's going to be easier to see these things. But these two rounded surfaces are where the first vertebrae of our neck meet up with the occipital bone and can slide and rotate around. And these flattened surfaces that form joints are called condyles. And this is the occipital bone, and so these are the occipital condyles, the smooth rounded surfaces that bones can articulate or form joints with and slide past one another. If we are moving from the magnum foramen, the foramen magnum, up to the occipital condyle, if we keep moving sort of up and over more, we hit our first really large and interesting foramen. And this foramen right here is called the jugular foramen. It's where our jugular blood vessel moves through. And if we keep moving up from there, we hit this hole right here, and here it is on the other side. And these are the entrances to the carotid canal, another blood vessel. Huge blood vessels that need to have holes in the skull so that they can get the blood supply to the brain. The other foramen that I'd like us to check out, if we move straight down the midline of this region right here, we can see the major foramen that I would like us to talk about. And there's two, and they're in pairs, so there's two on either side. So there's four holes that I'm going to point out, and they have two different names here. This hole right here is the foramen lacerum, and here's the foramen lacerum on this side. And then if you slide out and up a little bit more, we hit the next foramen, and this is the foramen ovale. So here's the foramen ovale on this side, and here's the foramen ovale on that side. We're not going to learn this one right here, but there's the other major foramen of the skull. So again, these two foramen are the foramen lacerum, and they sort of look like, if you can look straight through them, and we'll do this in class, if you can look straight through them, they look like a little teardrop shape. And you can see a little teardrop shape, or a little triangular shape, and that is the foramen lacerum. And then the foramen ovale is a little oval shape. It's kind of perfectly little oval. And so I'd like us to know these two foramen from this view. I think that hits most of the structures here. Again, if we miss any, please just write them down. Okay, this view right here is if you were to take like a baseball cap and cut a hole in the top part of our skull and then look down through that hole, that's what we're looking at here. So this is a cut that forms a top and a bottom. This is a transverse cut. So it's a transverse cut. Look at that right here. A transverse cut straight through the skull like that, and then we're going to look down at the skull structures right here. So what are we seeing here? This is the frontal bone, the forehead bone. So this is the anterior surface, and then this is the occipital bone, and this is the posterior surface back here. And what we can see is we can see this frontal bone. We've got another interesting view of this sphenoid bone right here. We've got our two purple temporal bones around our ears. We've got our parietal bones on the side of our skull, and then in the back we've got our occipital bone. What are the structures that we can see from this view that are interesting? We can still see that foramen magnum. Beautiful. The next hole, as we would move up and out from that foramen magnum, is our jugular foramen. The jugular foramens can be seen here. We can also see a new hole right here, and there's two of them, and our ear would come straight through this temporal bone, and we can see the internal acoustic meatus coming through this internal hole right here. We saw the external acoustic meatus from the outside of our ear and the outside of the temporal bone, and now we can see the inside part of it right here. It's a great view to see this. Next up, we've got our two holes that are kind of side by side with one another. Here we've got our foramen lacerum, which kind of merges with the carotid canal, the opening to the carotid canal right there. And then we've got the foramen ovale on either side of those. Inside and on this sphenoid bone right here, there's this little pouch, or it looks like maybe a little saddle. It's this long kind of saddle-like cup, and in here is where our pituitary gland would sit, and it's a little spot that gland can hang out in, and this is called the sella turcica. The sella turcica of the sphenoid bone is this structure right here. Here we can see that ethmoid bone, that purple bone that formed like the inside part of our eye socket, and we can see a couple cool structures here. I'm going to show us these in a second here. This ethmoid bone has a crista galli, or a central point that sticks up, and then the main part of the bone that sort of hangs onto that is called the cribriform plate. So we can see the top part of this little structure, this little bone, is the crista galli, and then the rest of the structure holding that in place is called the cribriform plate, which I'm going to show us in a second here. Okay, I think I'm going to skip over this text. Some review. Okay, let's look at this view right here. Okay, here we can see an inferior view, a posterior view. So from the back, and you can see some of the inferior side down here. But here's a posterior view. We've got our two parietal bones, and here we've got the nice image of that sagittal suture, the joint between those two bones. Then the joint between these parietal bones and this occipital bone back here is the lambdoid suture right there, that lambdoid suture. We can see our temporal bones on either side. We can see the foramen magnum, that hole for the spinal cord, and then we can see our two occipital condyles that the vertebrae are going to sit on, and it allows the head to rotate around on top of them. Anything else? We can see our cheekbone or zygomatic bone from here. I think that's about it. So these next images are not going to be in your handouts. They're in the slides for us to look at. And I'm not going to quiz us or assess us over these. They won't be on our practical. But it's kind of useful to look at some of these from different views. So here is the temporal bone with all of its structures, like the zygomatic process or the part that forms the zygomatic arch, the external acoustic meatus, and then that mastoid process right here. So this was that temporal bone right there. Let's also take a look at the mandible, and this view could show up on our exam, so it's not in red underlined text. Here is the mandible, the lower jaw. Here was that mental foramen that we've seen before, little hole where nerves can run through. And then this has got a great view of the inside part of the mandible, and here's the other foramen on the mandible that I'd like us to know. This is the mandibular foramen. And if you're struggling to find the difference between the mandibular foramen and the mental foramen is on the front surface, or the anterior surface, and then this mandibular foramen is on the inside surface, and it has an I in the word. Mandibular foramen is on the inside, mental foramen is on the outside because it doesn't have the I in it. Okay, the ethmoid bone. Here's what this ethmoid bone looks like, and here's where it's placed, and now we can kind of see all of its structures. When we look at the inside part of the orbital, you can see this surface of the ethmoid bone right there. When we looked at that top transverse view looking down, we could see this tip and then the main part. And then when we looked through the nasal cavity, we could see these bottom pieces down here. So let's go over them again. We've got this crista galli, which is this center vertical pointing structure. Then the main part, the solid part of this bone that sort of holds it all together, is this cribriform plate down here. And then this merges straight into this long projection down the bottom that you can see down here. And this is the perpendicular plate of this ethmoid bone. I think this ethmoid bone looks like a little boat with a huge rudder and a little maybe mast at the top. So if this was the whole boat shape, the cribriform plate is kind of like in the center part of the boat. Then the mast of the boat is this crista galli, and then the huge rudder or fin at the bottom is the perpendicular plate, if that helps you. And again, we're going to look at this bone in class. Okay, here's views that are not, this one is not going to show up, but it's great to look at the skull from this view. Again, the way I look at facial bones, I start off at the tip of the nose and work my way back, and we can pretty much hit all of the bones that we want to know. So here's that nasal bone at the very front. We've got the maxillary bone next, the lacrimal bone in green right there, the ethmoid bone in purple, and then the sphenoid bone in yellow. Frontal bone up here in pink, zygomatic bone in blue, and then the maxillary bone, which we saw again right there. So as you're working your way back here, you can think nasal, maxillary, lacrimal, ethmoid, and sphenoid. That's most of the facial bones that we need to know. And if it helps, you can think of like N, M, L, E, S. And so you could come up with an acronym like not many lizards eat stuff. I don't know, whatever you want to come up with. And that might help us learn all of these bones working our way backwards. And like I said, that's kind of most of the facial bones. I think I got a couple more facial bone views. Feel free to check these out, and it might help us understand the relationship of 3 dimensions of where these guys fit together. But we're also going to look at these in a model, which is very nice to check out. Okay, let's continue to work down these axial bones. We've got this weird bone that hangs out in our neck. And what's cool about this bone is that it doesn't actually form a joint with any other bone. It's just held in place by some ligaments and some tendons. And it's kind of unique in that way. It's the only bone in the body that doesn't articulate with any other bone. And this bone right here is called the hyoid bone. The hyoid bone of the neck, just in front of the windpipe and larynx right here. This bone is kind of interesting because if there's an autopsy done to see how a person has died, they'll oftentimes check out this hyoid bone to see if it's broken, to see if there was like strangulation or some sort of neck asphyxiation that could have caused the death of that person that we're looking at. Okay, that's the hyoid bone, and then we're going to continue to work our way down. Let's talk about these vertebral bones right here. Our vertebrae, or our vertebral bones, are all of these bones right here, and there's 3 different regions to these bones. There's the cervical region, which is in our neck. There's the thoracic region, which is in our thoracic region. There's the lumbar, which is in our low back or our lumbar region, and then it ends with these 2 bones right here, the sacrum and the coccyx. I'm going to go over views of the vertebrae in a second here, but I would also like us to know that there are 7 cervical vertebrae in our neck, 12 thoracic vertebrae in our thoracic region or our midsection, 5 lumbar vertebrae in our low back, and then 1 sacrum and 1 coccyx. If you're having trouble remembering 7, 12, and 5, it's at the times that we eat food maybe, or eat meals. 7 a.m. we eat breakfast, 12 we eat lunch, 5 we eat dinner. Might not work for all of us, but maybe that's a way that we could remember these things. Okay. I would also like us to know about the curvatures of the spinal cord. So the vertebrae have a natural curve to them. Let me take a look at this image real quick. The vertebrae have a natural curve to them where the cervical vertebrae have an anterior bend. The thoracic region has a posterior bend. The lumbar region has an anterior bend, and then the sacrum and coccyx have another posterior bend. So it bends forward, backward, forward, and then backward. And this S and squiggle-like curve allows for the vertebrae to compress and flex a little bit, and they won't just snap if we put pressure on them. There's a couple exaggerations of these bends that I would like us to know about. The first one is called scoliosis, and you've probably heard of scoliosis before, but this is an S lateral bend to this vertebrae, meaning that it bends to the side instead of bending front and back. Or there's also a sideways curve, and you can see it here in this x-ray. So the vertebrae are sort of bending laterally instead of just anterior and posteriorly. And this is a super common, you might have gotten like checked for this in school where they kind of make you bend over, they look at the vertebrae. And occasionally, if scoliosis is bad enough, they might put us in a brace to help sort of fix and push these vertebrae back into place. And then there'd be a series of physical therapy that you can do to help strengthen the muscles that pull on these things. Next up, we've got kyphosis, and kyphosis is an exaggeration of the posterior bend in the thoracic vertebrae. It's this posterior bend that is a little bit exaggerated and pushes out of the back part right here. Lastly is lordosis, and this is an anterior exaggerated curve in this lumbar region, which happens quite a bit during pregnancy when there's a ton of force pulled on these lumbar vertebrae. It can push them forward more and exaggerate that anterior bend in the lumbar region. So I would like us to know what each one of these things are and be able to maybe pick them out from an image if I put one on there. Okay, here we've got structures of the vertebrae. So what we've done here is let's take one of these vertebrae and look at a superior view of it, look at it from the top down, and then we'll look at them stacked up and we'll think about some of these structures. First up, you can see that the main part of the bone right here, where most of the force of these vertebrae stacking up on one another come down on, is the body. Let me get my mouse back. Here's the body of the vertebrae right there. Moving posteriorly towards the back part of the body, we'd have this huge hole right here. We've got a hole for our spinal cord, and that hole is called the vertebral foramen. Foramen is a hole. This is a hole through the vertebrae. Vertebral foramen. Then we've got some of these huge processes that stick off of the back and sort of the back and side parts. This most posterior process right here, or big projection, is the spinous process, the back part of the vertebrae that you can see right here, the spinous process. Then we have two transverse processes that stick off of either side. And these processes are great for massive muscles to connect to pull and help rotate the vertebrae, or pull and help move us forward and backward. So again, we have the body, the vertebral foramen where the spinal cord goes through, the spinous process right off the back, and then two transverse processes off the side. The other things that we can think about here are the regions that connect these big parts together. So connecting the spinous process to this transverse process is this part of the spinal cord right here, and that is the lamina. So you can see the lamina on the posterior surface in between the spinous process and the transverse process. Then connecting the transverse process with the body are these two sides right here, and this part of the vertebrae is called the pedicle right there. There's the pedicle. Not to be confused with this little facet right here, the smooth surface, and that's where the vertebrae stack up on one another and can sort of slide past one another when they're stacked up. Other things that we can see from this view, it's kind of hard to see, I've got a better view, but coming out of the side of each one of these vertebrae stacked up together, there's a hole where our spinal nerves can exit, and those holes are called the intervertebral foramen. And I'll show us a better image of that in a sec. The other thing that you can see from the side stacked up between the body of one vertebrae and the body of the next one is this intervertebral disc, or this disc of fibrocartilage that the vertebrae can stack up on. Okay, here's another view. If this helps, we've got our vertebrae stacked together. Here you can really see this intervertebral foramen, and this is where the spinal cord would run up and down, and then the spinal nerves can exit laterally right there. And here's a great image of that intervertebral disc as well. Okay, I do want to highlight some cervical vertebrae anatomy because these ones are much smaller. They have one or two extra structures that we should check out. So, as usual, here's that vertebrae. Here's the body of the vertebrae. Here would be the vertebral foramen, the hole where the spinal cord would move through. Here's that spinous process on the back. It's got two little points back here, as opposed to one of those other vertebrae. Then we've got the lamina. We've got the pedicle connecting the transverse process to the body. We've got a new hole here. This hole is the transverse foramen right next to the transverse process. So in this one, the transverse process isn't this huge projection on the side and back. It kind of moves a little bit more anterior, and it's smaller. It's smaller, and it's got this little hole inside of it, and that's the transverse foramen. The top two cervical vertebrae, C1 and C2, have their own special names. C1 is called the atlas, and C2 is called the axis. And these two bones get their own names because they're really important. They sort of are the connecting point from our vertebrae to our skull. And what's cool about them is they form this special pivot joint where C1, the atlas, can rotate around C2 really nicely. And the reason it can do that is because C2, the axis, has this vertical projection on it. And you can see it right here. This vertical projection is called the dens. Keep in mind that the dens is on C2 and it sticks up so that C1 can wrap around it and rotate around it. So it's on the lower one, it's on the axis, and here's that little dens projecting straight upward. Okay, we've got thoracic vertebrae. I'm not going to go into detail on those. And then lumbar vertebrae underneath those. Keep in mind that there are 7 cervical, 12 thoracic, and then 5 lumbar, and they're numbered from the top to bottom, 1 through 7, 1 through 12, and 1 through 5. At the very bottom, we'd have the sacrum and coccyx. The sacrum is 5 bones that are usually fused together. Not in every case, but they're fused together here. And it forms like the back part and bottom part of our long vertebral column. And then at the very bottom, we have the coccyx. And the coccyx is this little tiny bend, and it's about 2 or 3 bones that are fused together. And this coccyx is typically called the tailbone. It's at the very bottom tip. And if you've ever fallen on your butt and bruised or broken your tailbone, it is that little bone right there. And it is very sensitive and it breaks off very frequently. There's not much you can do when it breaks. You just got to kind of let it heal. Okay, finishing up axial skeletal anatomy is our rib cage. So here in this view, we can see our rib cage, we can see the vertebrae at the back, and then we have these rounded bones that move all the way around the thoracic cage and forming this thoracic rib cage. We've got 12 ribs on the left and 12 ribs on the right for 24 total ribs. And what's cool is that the 12 thoracic vertebrae all have 1 rib coming off of each side. So the 12 thoracic vertebrae have those 12 double-sided ribs, or 24 ribs coming off of them. And that's noteworthy of that thoracic. The thoracic vertebrae, they all articulate with ribs. The cervical and the lumbar do not. Working our way from top to bottom, rib number 1, 2, 3, 4, 5, 6, and 7, these are all called our true ribs because all of these ribs, 1 through 7, they have cartilage that connects them directly to the sternum. You can go from this rib and follow this costal cartilage directly to the sternum. Ribs 8, 9, and 10, their cartilage meets up with each other and then merges with the cartilage of 7 and then meets up with the sternum. And so we would call these ones, 8, 9, and 10, false ribs, where they don't have a direct connection to the sternum. It's a false connection where it connects first to 7 and then to the sternum. And then floating ribs are ribs 11 and 12, and these are ones that do not have any connection to the sternum at the front. As you can see, we've been talking about it. This breastbone right here is the sternum, and here's the sternum isolated. And the sternum has 3 major bones that make it up, and they're fused together, or some of them just have a joint between them. This part of the sternum is the manubrium. We've got the manubrium up here. We've got the body of the sternum down here. And then this point at the most inferior side here, we've got the xiphoid process, a little point, and it serves as a great point of attachment for all of our abdominal muscles to come up and attach to. Okay, I think that's it for axial anatomy. So I'll make another video for appendicular anatomy, and I'll see you all soon.